Hi, I'm Joe Martin. On today's show, we're going to talk about total knee replacements and total hip replacements. But before we get to the replacements, let's talk about the condition that causes you to have a hip replacement in the first place. That condition is arthritis. Now, you can get injured as an athlete while you're a teenager. You can have an auto accident. Maybe you fall on the ice, a fracture of the knee or the hip, or arthritis can set in for no reason at all. Between the years 2007 and 2009, 50 million American adults were told by their doctor, you have arthritis. Now that we know the prevalence of arthritis in America, we have three very important questions to ask ourselves. Number one, can we prevent arthritis or can we reverse its progression? And the answer is no. Through our behaviors and our activities, can we actually speed up the progression and make our knees and hips worse quicker? Absolutely. The most important question, and the one I consider most exciting, is can we slow down the progression of arthritis? I believe the answer is yes, we can. If we're going to slow down the progression of arthritis in our knee joints and our hip joints, there are three primary components that we must focus on that I believe we have some sort of control over. Number one is the mobility and the flexibility of the joint. When the joint is stiff and immobile and the muscles around the joints are shortened, it causes grinding in the joints when we go through normal activities of daily life, like sitting, standing, driving, climbing stairs, climbing ladders, walking, running, all of those activities. If you don't have proper flexibility around a joint, lack of mobility around a joint, you're causing undue stress on that particular joint. So having mobility in our joints helps us move. But now we go to strength and stability, because having stability in a joint helps us move efficiently. Now, when we talk about muscle strength and joint stability, let's talk about the hip and its relationship to the pelvis when we're walking. If someone has weak muscles on the outside of the hip, can cause the pelvis to depress on the opposite side, causing abnormal loading in the hip joint. This can exacerbate arthritis, can inflame your joint, and it can tear away at the cartilage. And the third area of concern that I feel that we can have the most control over is controlling our body weight. Obesity is significantly associated with arthritis and the progression of arthritis. I like to use an open sores on the knuckles analogy. If you had open sores on all of your knuckles and you turned your hand upside down and you rubbed it on the pavement, you grinded it into the pavement, then you take someone that's 30, 40, 50 pounds overweight, stands on your hand, and now move your hand and grind it into the pavement. You can kind of see what happens to the sores on the back of your hand. Well, that's what's happening to an inflamed, deteriorated joint. When you have excessive body weight, it's a real stiff, tight joint, you don't have much mobility, and there's no strength and stability at the joint. Unfortunately, in America, all of these conditions are all too commonly present in someone's hip joint or knee joint. This is what throws us into a vicious cycle that eventually leads us to a total joint replacement. Let's start with pain in your hip or knee. That leads to decreased activity levels because people don't want to do anything when they're in pain. This leads to increased body weight and decreased flexibility in the joint. Decreased strength follows. Increased shear, grind, and compression that we just talked about, all those excessive forces at the joint. And then we get into the arthritis progression with inflammation. All of these things leads to arthritis progression with inflammation. And finally, there's so much pain and loss of function, you are forced to spiral out of the cycle and right into joint replacement surgery. Now let's get out of this joint. But when we come back, we will show you what a joint replacement looks like, and we will meet one of my patients who recently had a total knee replacement. And make sure you don't go anywhere, because later in the show, I will introduce you to a program here at Function Better called Total Joint Champions that can get you in tip-top condition prior to a joint replacement and get you back on your feet quicker following surgery.